Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Hope you all have a great day. First of all, let me say thank you for having me. My name is Rati Purnamasari and my partner, Vera Widyastuti. We are from Poltekkes Kemenkes Padang, West Sumatra. Now, I'd like to present our paper with title Teenage Pregnancy in Indonesia, the Determinants and Outcomes. We will discuss about 5 parts: introduction, method, result, discussion, and conclusion. First, I want to tell you about introduction. As we know, in this century, teenage pregnancy is still one of the problems worldwide, especially in low and middle income countries. Data from Indonesia Demographic Health Survey 2017 showed 7% of women aged 15 to 19 years have become a mother. Wow! Teenage pregnancy can be influenced by various factors. Teenage pregnancy poses a high risk both to the mother and also affects the baby. So, the aim of this study was to review determinants and outcomes associated with teenage pregnancy in Indonesia. Secondly, let's talk about method of this study. This study is a literature review. An advanced searching article in July 2021 was through the journal databases of PubMed, ScienceDirect, and Google Scholar in the last 10 years. The keyword used are teenage pregnancy or adolescent pregnancy in Indonesia. Selection article for our review used inclusion criteria consist of study articles written in English or Indonesian, original research and full text can access freely, study site in Indonesia, quantitative study, and discuss about determinants or outcomes of teenage pregnancy. Okay, now I want to show you about flow-up selection process. The first stage, we identify as many as 886 articles from 3 databases and 16 articles meet the inclusion criteria and eligible to review. Move to the result. This literature review has been defined into 2 sections, determinants and outcomes. 8 articles discuss about determinants and 8 articles discuss about outcome of teenage pregnancy. The data analyzed were synthesized and organized. In the table that we can see there are 5 determinants of teenage pregnancy: early marriage, economic status, educational level, knowledge, and access to and in this table we can see there are 4 outcomes of teenage pregnancy: anemia, preeclampsia, preterm, and low birth weight. According to the result, we synthesize 5 interrelated determinants. Number 1, early marriage. Most teenage pregnancy in Indonesia were in marriage status. 2 studies indicates a correlation between marital status and teenage pregnancy. As we know, marriage indicates sexual activity. There is a view that marriage can be a solution to reduce the family's economic burden. Early marriage also occurs in several countries like Ethiopia and Sudan. Number 2, economic status. A study used data from Indonesia Demographic and Health Survey showed wealth status related with incidence of teenage pregnancy. The lower wealth status, the higher risk of teenage pregnancy, and vice versa. The results of the study are similar to the result of studies in other countries such as Ethiopia, Sudan, Zimbabwe, and Nigeria. Number 3, education level. The result of 2 studies also showed a higher chance of teenage pregnancy in teenagers with low education. The other studies from Sudan and Ethiopia reported similar results. Education has a relationship with the knowledge and information that someone has. However, in some areas in Indonesia, there is inequalities to access education for women. Number 4, knowledge. Lack of knowledge about reproductive health and unsafe sexual behavior are determinants of teenage pregnancy. For studies express teenagers with lack of knowledge about sex and reproductive health have a higher chance of getting pregnant. Study in Ethiopia also shows similar results. However, the majority of Indonesian parents considers this is a taboo topic to be discussed with their children. Number 5. Access to information. Access for information is one of the main determinants of teenage pregnancy. Access to health information related to teenager knowledge. The teenager pregnancy rate was lower in group who received the promotion program. And how about outcomes? Based on studies of teenage pregnancy in Indonesia, we synthesized 4 maternal and neonatal outcomes. Number 1, anemia. 3 studies found that anemia at childbirth was a higher risk on teenage mothers. A cross-sectional study showed that anemia as a complication of teenage pregnancy has the greatest risk compared to the other complications. The result of similar studies also reported from Malaysia, Republic of Macedonia, Greece, and Oman. The majority of anemia is iron deficiency anemia. There is double burden risky worsening condition in teenage pregnancy. Number 2, preeclampsia. A study in Bali showed that 20% of teenage pregnant women had preeclampsia. Another study found that preeclampsia was higher in pregnant women aged 12 to 15 years and 16 to 19 years. The other studies from Greece and Turkey reported similar results. Besides, uterine immaturity is one of main rationales for many maternal complications in teenage pregnancy, including preeclampsia. Number 3, preterm birth. A study showed that preterm is one of the most common complications in teenage pregnancy. This study in line with 2 other studies in Indonesia. The studies from Malaysia, Oman, Nepal, Taiwan, Thailand, Nigeria, Oman, Turkey, and China also show similar results. Number 4, low birth weight. The result from Indonesia Demography Health Surveys studies found that teenage pregnancy poses a risk to health of the baby, including low birth weight. Low birth weight is also one of consequences of teenage pregnancy in other countries like Malaysia, Nepal, Oman, and Taiwan. Infant health of teenage mothers was associated with increased nutritional needs and a double burden to growth of baby and mothers. In conclusion, from data I mentioned before, we can conclude early marriage, economic status, education level, knowledge, and access to information are dominant and interrelated determinants of teenage pregnancy in Indonesia. Teenage pregnancy is risky for maternal and neonatal outcomes such as anemia, preeclampsia, eclampsia, preterm birth, and low birth weight. Outcomes of teenage pregnancy in Indonesia show similar impact with studies in other countries. This problem needs a comprehensive effort to prevent and decrease the teenage pregnancy. We are at the end. I know my presentation brings up a number of questions from you, so feel free to give us a question and let's discuss more. Thank you for listening. See you on the next chance. Assalamualaikum warahmatullahi wabarakatuh and good morning.